This morning, the search continues for the suspect who shot the UnitedHealthcare CEO on a city street. Last night, police released these new photos of the suspected shooter. It appears to be from a camera mounted inside a taxi. The FBI is now offering up to $50,000 for any information that could lead to the arrest of Brian Thompson's killer. NYPD now saying they believe the suspect may have fled New York. And while investigators haven't locked down a motive for the deadly shooting of the UnitedHealthcare CEO, the killing has triggered a wave of anger and criticism on social media. Much of it is aimed not at the shooter, but at the health insurance industry rather. And we get details this morning from Kelly O'Grady.
You think that I didn't need anesthesia to have surgery? You're insane.
One thing Americans can agree on, their dislike of the health insurance industry.
We're fighting with the insurance company over her dialysis to keep her alive.
On social media, pent-up frustration spilling out into public view. One possible reason, 12% of claims were denied last year, a 20% increase from 2020. While a 2023 survey found nearly 60% of insured adults experienced some issue with their coverage in the previous year.
The system is broken.
57-year-old Roseanne Neal fought breast cancer twice and then battled her insurance company over a follow-up mammogram in 2015. Neal says her $800 reimbursement was denied 3 times.
When you're not feeling well and still recovering from certain surgeries and you have to deal with an insurance company, it just compounds the emotional and psychological toll.
As well as an economic toll. Roughly 100 million Americans are in medical debt, exceeding $220 billion, while 41% of insured adults said they delayed or skipped some form of medical care within a 12-month period due to the expense.
People are denied access to care. It doesn't matter what your policy says.
Wendell Potter is a former healthcare executive turned advocate. He says the focus on profits is hurting patients.
They make it increasingly difficult for people to get the care that they need, that their doctors order. And they do that for one reason only, and that is to reward their shareholders.
Experts say the appeal process is so complicated, less than 1% of denied claims are actually challenged. Meanwhile, the trade association representing insurance companies says they are working to make coverage and care as affordable as possible. Kelly O'Grady, CBS News, New York.